Hello everyone. Today we are going to discuss about standards of mental health nursing. There are some standards every nurse has to follow while giving care to the patient. We will see what is mental health nursing standards. The mental health nursing standards are classified into two sections. They are professional practice standard and professional performance standard. First we will see professional practice standard. Professional practice standards are six standards. They are theory, data collection, diagnosis, planning, intervention, and evaluation. First one is theory. We will see what is theory. Theory means a system of idea to explain something. Theory always based on some principles. Theories in psychiatric nursing provides a basis for nursing care. These theories are formulated based on scientific observation and study. Nurse must apply theory in nursing care based on the situation of the client to take appropriate decision. Second standard is data collection. Data collection is considered as the basis or starting step of every patient care. Data collection is helpful for assessment of the patient. For that, nurses must collect subjective and objective data. This process helps to gather all information about the patient. To diagnose the condition as well as to plan the care, data collection is very much necessary. So, nurse must follow the standard in right way to provide maximum care to the patient. Systematic methods are using to collect data. The systematic methods include observation, interviewing, etc. Third standard is diagnosis. Diagnosis means identify the disease condition. Nurse can understand the diagnosis of patient by checking the medical records. Actual and potential problems of the client needs to be assessed to prepare proper nursing diagnosis and care plans. Nurses need to use critical thinking to interpret the data for nursing diagnosis. There are three types of nursing diagnosis are there. They are actual nursing diagnosis, health promotion diagnosis, and risk nursing diagnosis. First, we will see what is actual nursing diagnosis. Actual nursing diagnosis means diagnosis of present problem. Health promotion diagnosis means health promotion diagnosis is using to improve nursing care or health care. Risk nursing diagnosis is about diagnosis of risk factors which trigger the condition or which trigger the mental health problem. Next standard is planning. Planning includes two processes such as problem solving and decision making. Nurse can participate the client also in the planning process. Planning includes psychotherapeutic interventions. Accurate planning is necessary to provide exact care to the patient. Three types of plannings are there such as initial planning, second one is ongoing planning, and third one is discharge planning. Planning steps are entirely different in each types of planning. Each type means initial planning, ongoing planning, and discharge planning. Always set the plans based on the priorities and goals. Next one is implementation. Implementation means performance of the plans and record the effect of plan. So, process of implementation include two steps. They are performing the plans. Second one is documentation or recording of the plan. Implementation should be priority based and systematic to avoid complications. Next one is evaluation. Evaluation is the process of checking the effect of plans on the patient. Evaluation process will collect the feedback from the patient to make corrections. Evaluation helps to understand the progress of care and patient's reactions towards the plan. Evaluation feedback help the nurse to compare the data and plan of care. Next, we will see second classification, that is professional performance standards. Under that, we can see peer review, continuing education, interdisciplinary collaboration, utilization of community health system, and research. We will see what is peer review first. The purpose of peer review is to ensure the quality care through evidence-based practice. The first definition of nursing peer review prepared by ANA, that is American Nurses Association in 1988. That is, peer review in nursing is the process by which practicing registered nurses systematically access, monitor, and make judgment about the quality of nursing care provided by peers as measured against professional standards of the practice. Peer review implies that the nursing care delivered by a group of nurses or an individual nurse is evaluated by individuals of the same rank or standing according to established standard of practice. This is the definition of peer review by American Nurses Association. Peer review helps the nurse to feel safe while giving care, and also it promotes high standard of care. Next standard is continuing education. Continuing education in nursing improves the quality of nursing care. It enhances the knowledge of nurses. Continuing education provides current information to nurses related to the field of nursing care and practices. To understand the changes in nursing practices and procedures, nurses must participate in continuing education. It's very important. It also helps to know the advanced technologies and equipment used in nursing procedure. Continuing education is offered by respected hospitals and authorities in particular time for nurses to improve their knowledge and skills. Next standard is interdisciplinary collaboration. It means create interprofessional cooperation between different healthcare departments to provide utmost care to the patient. For example, mental health nursing is working with physiotherapists and dietitians. They are separate departments to provide adequate care to the patient. For that, nurses will review the plan of care to ensure the continuity in care. For interdisciplinary collaboration, nurses must practice interdisciplinary communication first to get a mutual understanding between each department. So, interdisciplinary collaboration will improve the standard of care. Next one is utilization of community health system. Community health centers or community health system provide community-oriented health care to the needy people in the community. Community healthcare services provide care to the people, those who limited access to healthcare or those who have limited access to the healthcare. Community health service is mainly focused on three aspects of care, such as primary healthcare, secondary healthcare, and tertiary healthcare. Community mental health services is focused on people with mental illness. Community-based care is actually helping the community in effective way to decrease the inpatient mental health care which is delivered in the hospital. So this is an important standard, utilization of community health system. Next one is research. That's the last standard. Mental health research helps to improve quality of life of mentally ill person. Mental health research also supports the society by reducing the level of mental illness, discrimination, and stigma in the field of mental health. Every mental health nurse is a part of mental health researchers to provide quality and advanced care to the patient. So we can conclude that we had a discussion regarding the standards of mental health nursing. Mental health nursing standards are the level of quality to provide quality care to the patient. Every nurse must follow these standards to measure, plan, and evaluate the care they have given to the patient. Thank you.